وريتنشن اوف بايكربونات. فهي ميكانيزم خاصه بالرينال سيستم. هلا راح نمر على بعض الامثله، يعني specific examples when we talk about acid base balance، لانه للامانه مش رح نقدر نوصل للرينال عن ريسبيراتوري، بس راح نركز على ريسبيراتوري اكثر من الرينال بالار اس سيستم، وباليو جي اس بنتكلم عن الرينال سيستم. طيب خليني هلا بس اعمل شير للسكرين بس ابلش المحاضره. اوكي ثواني. طيب في شغله كنت نبهت لها، الناس اللي بالويتنج روم بدخلوا من حسابات غير اللي بالجامعه، غير ايميل الجامعه، فبجوز ما اشوفك، بجوز ما انتبه لك. يا جماعه حاولوا استخدموا الايميل تبع الجامعه. طيب أنا معكم بس ثواني لحد ما ينتهي الأذان إن شاء الله. طيب يا جماعة، هلا كنا تكلمنا المرة الماضية عن الأسيد بيس بالانس والبيسكس اوف ذا أسيد بيس بالانس. وصلنا أعتقد عند سلايد بيتكلم عن the role of the acid base balance. ننتبه شوي على العلاقة الموجودة هون. نتكلم عن الإريثروسايت as well as the similar thing is going to happen in other cells. but because the RBCs or erythrocytes are the predominant cells that we have in our circulatory system. So this is what's going to happen when we have acidosis condition due to metabolic acidosis, or it could be either respiratory acidosis. It means that you have acidic condition in the blood and you have high concentration of hydrogen ions, which lowers the pH value. This condition is associated with hyperkalemia. On the other hand, if we have low concentration of hydrogen ions or high pH, this will be associated with what's called hypokalemia. It means that low concentration of potassium in the blood, in the serum itself or the plasma, okay, compared to the normal situation. هلا بالنسبة للإريثروسايتس or intracellular compartment, it's very well known إنه potassium concentration is higher in the erythrocytes or in this intracellular cell compartment. هذا الشيء معروف. ولكن the movement of potassium also depends on the availability of cations like the hydrogen ions. So if we have high concentration of hydrogen ions and acidic condition, the hydrogen ions will start to move to the red blood cells in order to have some kind of compensation or kind of acid-base balance by having the buffers that we have in intracellular compartment. And this will cause a replacement of a flux, if you would, the potassium from the red blood cells to the plasma or the serum, which will cause hyperkalemia. ولما نتكلم عن الهايبوكاليميا والهايبركاليميا، هلا واحد رح يقول لي يعني اكيد في اعتقاد او ثينكينج انه والله الموفمنت للبوتاسيوم ايونز يعني قديش بتعمل هايبركاليميا او هايبوكاليميا. If you consider انه the concentration of potassium outside of the cell is 4.5 most of the time millimolar, which is subjected to any change in the potassium concentration, will cause a drastic change in the effect of that potassium compared to the intracellular concentration of that potassium. هلا داخل الخلايا راح يكون التركيز تقريبا 120 مليمولر للبوتاسيوم compared with 4 or 5 millimolar of the potassium outside of the cell. So the concentration of the potassium is outside of the cells أو بالبلازما. التغير في التركيز تبعه بيؤدي إلى عواقب وخيمة جدا حتى لو كان هذا التغير بسيط جدا. وبالتالي لما يكون البوتاسيوم 6 راح تكون في عندنا مشاكل كبيرة مرتبطة بالبوتاسيوم، ممكن تكون renal failure or any other cause of the high concentration of potassium. فالهايبركاليميا is significantly decided to be hyperkalemia when we talk about just small change in the concentration of the potassium. While if you talk about, for example, the sodium concentration outside of the cell is like 140. So if it becomes, for example, 145, يعني زدتها انت تقريبا 5 millimolar, it will not that big deal compared to the change in the potassium. فلأنه تركيز البوتاسيوم قليل فالتغير الطفيف في البوتاسيوم راح يعمل إفكت بالمقارنة مع أيونات التركيز تبعها عالي جدا. وبالتالي الحالة الأولى أنه إذا كان في عندنا acidosis, there will be an efflux of potassium from the erythrocytes to the serum because of the entrance of the hydrogen cations. Vice versa will happen when we have alkalosis condition. The hydrogen ions will start to move outside of the cell, so this will be exchanged with the potassium ions, causing a condition of hypokalemia. We have special case of a kind of controversial issue compared with what we learned now. الشيء اللي تعلمناه قبل شوية إنه عندك acidosis, hyperkalemia, alkalosis, hypokalemia. While in the renal tubular acidosis, which is different condition, it means that the tubular cells of the renal system becoming acidic, or they will have what's called acidosis due to failure of excretion of the hydrogen ions. في مشكلة في إخراج الهيدروجين من هذول tubular cells, so they will cause acidosis. These cells are responsible also for the absorption or reabsorption of the potassium. هلا إذا أنت مش قادر تطلع الهيدروجين, so you will not reabsorb the potassium to the blood, which will be associated with hypokalemia. So this condition of acidosis is different from the blood acidosis. It's specific renal acidosis that will be associated with hypokalemia, and you have to be careful when you study this topic or when you discuss it. Now, let's talk about the factors affecting renal excretion of acids what are the factors that will affect the renal function in order to release hydrogen ions, or even sometimes reabsorb the bicarbonate. First of all, the increased filtrate load of bicarbonate. How much of bicarbonate you filtrate every day, or how much the renal system is going to filtrate of bicarbonate during the day. The second thing is the volume of the extracellular fluids. It means that how much of water you have in your renal system in order, or in your blood, in order to be filtrated by the renal system or to be released by the renal system. لأنه إذا عندك كمية مية كبيرة, you have to release it from the body by the renal system and respiratory or the skin, for example. Decreased in the plasma pH, which means that you have acidosis condition in the خلينا نشوف بس ايش الشات اللي هون. الصوت بقطع. النت عندي بأحسن حالاته, ما بعرف, أكثر من حدا بيشكي من الصوت. I don't know.
كان بقطع أول محاضرة بس.
هلا كويس. طيب إذا صار إشي يحكوا لي. طيب high concentration of carbon dioxide. أنا صلحت المحاضرة الأولى ولسه فيها خطأ بسيط اللي هو CO2 rather than CO. So the partial pressure of the carbon dioxide is also a cause of the renal function to excrete the acidic solution. Hypokalemia itself is also another factor that will be associated with the excretion of the acids, and the amount of aldosterone that you have, اللي هو diuretic hormone that you have in your blood, that will affect secretion of water as well as the salts with that water. So these factors are playing a major role in the excretion of the renal acids. Now let's have some kind of comparison between the parameters that you will see when you have acid-base disturbances. For example, in the respiratory acidosis, basically the cause is gas that will be associated with acidic condition, which is very well known in carbon dioxide. So if you have high concentration of carbon dioxide and the partial pressure is more than 45 millimeter mercury, so the condition will be, or the condition that is going to be developed, اللي هو respiratory acidosis. And vice versa, if you have lower concentration of carbon dioxide, less than 35, اللي هو normal level راح يكون 40, so you will have respiratory alkalosis. So in these conditions, we have a respiratory cause. We have a gas that will be associated with the acidosis or alkalosis. While in the metabolic story, the bicarbonate is the major player. So if it's higher or lower than these values, 33 or 22 millimolar, so you'll have either metabolic alkalosis or metabolic acidosis. And if you talk about the hydrogen ion concentration, it will be considered acidic condition if it's more than 42 millimolar. We are talking about hydrogen ion concentrations, not the pH value, okay, which is the same thing. The hydrogen ion concentration will be will be related to alkalosis if it's lower than 38 nanomolar as a concentration or as a pure concentration. Let's discuss some types of acid-base disturbances اللي هو نقارن الميتابوليك مع respiratory one. So if you have, for example, metabolic acidosis, there will be for sure decrease in the pH value as well as in the respiratory one because it's acidosis. But the cause of the metabolic acidosis is deficit in the bicarbonate compared to excess carbonic acid أو بينجو saying excess in the carbon dioxide, and both of them are causing reduction in the ratio between bicarbonate and carbonic acid بحالتين الأسيدوسيس، ولكن السبب مختلف. السبب إنما بايكربونات في الحالة الأولى بينما بالريسبيراتوري اللي هو الكربونيك أسيد أو الكربون دايوكسيد. هلا الريشيو حدا كان سألني بالمحاضرة الأولى إيش ال20 هاي ريشيو اللي هي تركيز أو نسبة البايكربونات للكربونيك أسيد أو البايكربونات للكربون دايوكسيد، لأنه الكربونيك أسيد والكربون دايوكسيد representing the same thing. So if we have lower ratio, it means that you have higher acid compared to the alkaline component اللي هو البايكربونات. So it will be acidosis. While in the alkalosis condition, if it's metabolic, there will be excess in the bicarbonate. Compared to the respiratory one, we will have deficit in the carbonic acid or carbon dioxide. We have like reduction in the carbon dioxide. It means that we have kind of hypoventilation due to certain drugs, certain toxins, or many other factors, or the stress of the respiratory system. So in these conditions, we have higher ratio of bicarbonate compared to the acidosis condition. In the acidosis condition, we have a lower ratio of bicarbonate to the carbonic acid. Okay. هلا, what is the compensation mechanism اللي بتشتغل في الجسم? Okay. For the compensation of metabolic acidosis, we will have decrease in carbon dioxide by doing what's called hyperventilation. كيف أنا بتخلص من carbon dioxide؟ إذا في عندي metabolic acidosis لازم أتخلص من carbon dioxide عشان أعدل الريشيو, and this will be performed or conducted by hyperventilation, إنه بتنفس أكثر. Okay. هلا في metabolic alkalosis you have to increase the carbon dioxide in the blood. And how can we do that? يعني كيف أنا بزيد الكربون دايوكسيد بالبلد؟ حد يجاوبني بشكل سريع إذا كان متابع معي.
Hyperventilation.
إيش هو؟
Hyperventilation. أو deep breath.
أو إيش؟
deep breath.
كيف يعني deep breath؟ عمرك سمعتي حدا بيعالج ب breathing bag بسموها؟ كيس ورق أو أي كيس, and just make respiration in that bag. So it means that you are going to increase the carbon dioxide in your body. اللي هو ممكن تكون جزء من hypoventilation اللي حكيت عنها. It can be a process of by the body itself as a compensation mechanism. تمام؟ So ممكن تعطي واحد باج انت تقول له تنفس فيها مشان انه يعدل وضع الكربون دايوكسيد in the body. So he's going to breathe much more carbon dioxide. هلا برespiratory acidosis or alkalosis the solution will be by increasing bicarbonate إذا كان في عندنا acidosis, وهذا بيكون دور الكدنة. Okay, or sometimes you will take pills of the bicarbonate, or reduction in the bicarbonate by the renal system itself. So it will start to in the condition of alkalosis. So it's very logical to secrete more or to filtrate actually more bicarbonate in the renal system and retain of hydrogen ions in the body. I think the principle, the basic principle is very easy to understand. The take-home message that you have to remember all of the time when you are in the clinic, لأنه بكرة إن شاء الله كلكم تصيروا بأماكن بتشخصوا فيها مرضى. فمن أهم البارامترز اللي نتابعها في المرضى خصوصا لما يكون في عندنا مشاكل في الجهاز التنفسي اللي هو حالات الأسيدوسيس والألكالوسيس اللي بتصير عند هذول الأشخاص. هلا بداية as a condition الميتابوليك أسيدوسيس معروف إنه في عندنا low pH, low bicarbonate for example, and like normal carbon dioxide, and the ratio is going to be down lower than 20. هلا الcompensation will start here. If it's uncompensated, it will stay as metabolic acidosis. هلا partial compensation, you will start to lower الكربون دايوكسيد. أسهل شغلة بواسطة respiratory system اللي هو hyperventilation. هلا الفول compensation إنه أنت تعدل الPH بعد ما أنت نزلت الكربون دايوكسيد and you got the normal ratio. So in every kind of condition, you want to reach the same ratio of the bicarbonate to carbonic acid. أي مثال من هذول تأخذه. For example, let's talk about metabolic alkalosis. If it's uncompensated, it will be alkalosis due to the high pH value and high bicarbonate. If it's compensated, for example here, partially by the respiratory system through hypoventilation, and this is the fully compensated one. You still do hypoventilation and you corrected the pH value and you got the normal ratio of the bicarbonate to carbonic acid. So this is what the body gonna do. Now talking about something maybe new to you, and I do believe إنه بتعرفوا هاي القصة، بتعرفوا ما معنى الأنايون جاب. وحتى أبسط الموضوع بشكل سهل جدا، الأنايون جاب من اسمه فراغ أو فرق بين شحنات الأنايون المحسوبة والغير محسوبة. بمعنى آخر إنه هي بتقيس لك قديش الأنايونز اللي أنت ما حسبتهم عندك بالحسبة. أي حسبة معروف انه في عندنا كاتايونز بالبلد وفي عندنا انايونز. when you make subtraction of anions from the cations يعني تجمع قديش عندك تركيز الصوديوم والبوتاسيوم for example and subtract the bicarbonate and the chloride concentration from the sodium and potassium, you will get certain number, which is the 12 millimolar. Okay, so this is how we calculate it. You calculate the number of the cations and subtract anions from the cations, and the difference will be this gap. It means that you have anions you did not calculate or you did not measure actually. Okay, so we have certain anions at certain concentration اللي هم 12 as a normal concentration in this reference. ولا بحكي لك ليش this reference. هلا in the condition of acidosis, you can see the difference in the anion gap between the acidosis and the normal individual. So you will have low bicarbonate due to acidosis, and you will have high anion gap. So this is called high anion gap acidosis. If you take this example here, the anion gap looks normal. This is because you did a calculation in the following way. You make the summation of chloride and bicarbonate, and there was a hyperchloremic condition. في عندنا high concentration of chloride اللي بتغير في القيمة الحقيقية للانيون جاب. فالانيون جاب صار نورمال لأنه في عندك hyperchloremic condition. The chloride is high, so you have to consider that إنه الانيون جاب لا زال موجود، لا زال مرتبط، يعني لا زال مرتفع ومرتبط بالاسيدوسيس، ولكنه رياضيا مش قادرين نشوفه بسبب إنه في عندنا كلورايد عالي جدا. فبالتالي إذا بترجع الكلورايد للنورمال ليفل you will see the anion gap. ولكن هاي الكونكشن أو يعني هذا الانيون جاب اللي hidden is due to the hyperchloremic acidosis. في عندنا two types of acidosis. واحد بيكون في عنده high anion gap، واحد بيكون عنده normal anion gap. وزي ما حكينا حسابهم بسيط جدا، اللي هو تجمع تركيز ايونات الصوديوم ناقص الايونات السالبه وبيطلع عندك تقريبا 12 في هذا الريفرنس. طيب شو معنى بهذا الريفرنس؟ بدي اروح على السلايد اللي بعديه مشان اوضح هذا الموضوع. In another reference you will find the following calculation. So they consider الصوديوم 140 بوتاسيوم 4 و125 مجموع نيجاتيف ايونز. So the difference will be 19. هلا معنى ذلك انه كل population وكل let's say health institute على مستوى البلد، على مستوى national بنحكي they have their normal range of these parameters. ف you have to consider them. اوكي انه قديش النورمال رينج، وبعدين تعمل الانيون جاب الخاص بالمجتمع تبعك. ممكن انت تكون متقيد باللوائح البريطانيه او الامريكيه او الكنديه او الاستراليه. So they have their normal ranges according to their population. بس ما راح تكون drastic differences but you have to stick with one. يعني مش اليوم مثلا الانيون جاب عندك 12 نورمال رينج وبكره يصير 19 لانك غيرت الحسابات. لا، you have to consider the same calculations every time you use it. هلا لما بتيجي بتحسب هذا البارامتر لليورين it will be much more higher and it will be in negative. Okay, so the anion gap of the urine will be calculated as the following اللي هو تركيز الصوديوم والبوتاسيوم minus the chloride concentration, because usually the bicarbonate is not filtrated in the urine, it will be reabsorbed in the normal condition. So it will be like between minus 20 to minus 50 millimolar as anion gap of the urine when you consider urine as a solution for the calculation of the anion gap. The anion gap will be high under the following conditions اللي بيسموهم دكتور ميبل conditions. Okay, دكتور ميبل هي اختصار لعدة conditions. Diabetic ketoacidosis for example, renal disorders or renal failure will also be associated with high anion gap acidosis. Methanol and alcoholic ketoacidosis, methanol toxication, paracetamol toxication, lactic acidosis, for example, ethylene glycol, and salicylates. So Dr. Maples are the conditions that are related to the high anion gap عشان تكون سهل الأمور بالنسبة لحفظ الكونديشنز المرتبطة بهذا النوع من الأسيدوسيس. هلا هذول التيبلز شكلهم لأول مرة يوحي بالإزعاج، ولكن هو عبارة عن مبادئ بسيطة جدا مقارنة بين الشيء اللي أخذناه قبل شوي اللي هو دكتور ميبلز هاي انايون جاب ميتابوليك اسيدوسيس. ايش هم الاشياء اللي مرتبطين بالهاي انايون جاب اسيدوسيس؟ اوكي، HA GMA او النورمال انايون جاب ميتابوليك اسيدوسيس. الفرق واضح جدا، هذول حكينا عنهم اللي هو توكسيكيشنز او كيتو اسيدوسيس او رينال فيلر او وات ايفر. هلا اللي هو عباره عن اشياء اخرى بتخلي الانايون جاب نورمال بس وي هاف اسيدوسيس، وبالعاده بتكون ان اورجانيك اسيدوسيس اللي هو زي حالات الدياريه، رينال تيوبولار اسيدوسيس اللي حكينا عنه تايب 1 2 or 3 or 4 sorry, and we have anhydrase inhibition or certain intoxications with certain drugs. They are very simple or very easy to remember as factors that are related to normal anion gap metabolic acidosis. هلا في حالة اسمها lactic acidosis which is also a cause of metabolic acidosis, and we have high concentration of lactic acid in the blood, and this condition is called lactic acidosis. يعني حموضة بسبب تراكم حامض اللاكتيت. هلا اللاكتيك acid من وين بيجي أصلاً؟ Due to the oxidation of glucose, and the oxidation is not going to be complete, يعني partial oxidation, and that's why it's called lactic acid fermentation or lactate fermentation. It means that you are going to convert the glucose to lactate, and the body or the cells are not able to continue the process due to most of the time اللي هو reduction in the oxygen concentration. So the type 1 of lactic acidosis اللي بيسبب acidosis للبلد is due to the hypoxia, low concentration of oxygen. So this is called type A. Okay. The second one, and most of the conditions are related to the unavailability of the oxygen. That's why they are called hypoxia. The second type, which is called type B, is related to deficiency or impaired lactic acid metabolism without hypoxia, without low concentration of oxygen. It means that we have oxygen that is available, but we have something wrong with the oxidation process of the glucose. Could be due to toxins, alcohol, or certain genetic disorders. هذول بنسموهم الانبورن disorders أو mitochondrial disorders اللي ممكن تكون بسبب toxins أو ممكن بسبب mutation معين, or deficiency in one of the B vitamins. All of these things are related to the impaired lactic acid metabolism وبسبب metabolic acidosis, and this is called non-hypoxic إذا بدك or without hypoxia lactic acidosis. فالفرق بين اللاكتيك acidosis ال A وال B اللي هو وجود الأكسجين أو عدم وجود الأكسجين. Okay. هلا when we see decreased anion gap، الحالات السابقة ذكرنا فيها إنه في عندنا increase في الanion gap. Can we see decrease in the anion gap? Yes. In the hypoalbuminemia, it means that you have low concentration of albumin in the blood. Or لا سمح الله multiple myeloma, which is kind of markers that used for cancer. Bromide intoxication and hypercalcemia. These conditions are related to the decreased or reduction in the anion gap. We have something similar to the anion gap, but now it is a difference between what you measure and what you calculate. It's called osmolar gap. Osmolar gap means that you have a difference between what you measured as solutes, المذابات, and what you calculated. What you measured, we have an instrument that can measure the osmolarity. Okay, so it will say, for example, you have 300 or 280 millismol as an instrument. So you can test the osmolarity of the urine or osmolarity of the plasma. And you can calculate osmolarity اللي هو تركيز الأيونات الموجود في البلازما أو في اليورين. So the sodium as a number of particles, that's why it's called osmolarity, not molarity. Okay, you are measuring the number of the particles. Sodium ions will be multiplied by 2 plus glucose concentration and urine concentration. So these are the parameters that will measure or play a role in the osmolarity value. So if there is difference, which is present, normally it should be less than 10% milliosmol. This is the normal osmolar gap. If it's higher, so it means that you have a problem, which implies there is a presence of what's called unmeasured osmoles that you have in your blood, because there is a difference between what you measured and what you calculated. So it could be due to intoxication of alcohol or certain drugs or methanol or ethylene glycol, or sometimes poisoning due to certain what's called acute poisoning factors. Now, the compensation of metabolic acidosis, as we mentioned before, إنه بحالات acidosis مرتبطة بالبيكربونات, the respiratory system is going to compensate that by hyperventilation or by renal compensation mechanism, اللي هو excretion of the acids that you have because you have high concentration of ions. And most of the time it will be associated with hyperkalemia. And if it's corrected, it may cause, let's say, sudden hypokalemia. لأنه نحاول الجسم الآن يتخلص من البوتاسيوم. So due to the release of the potassium, you could develop kind of short-term hypokalemia. It's not that long-term. Can we treat metabolic acidosis? Yes, you can give bicarbonate, for example, اللي هو مشهور باسم الرينين. الاسم التجاري أنا بعرف المركبات البيكربونات اللي بتنباع بالفارماسيس, for example. Or you can give oxygen to the patients who are suffering from lactic acidosis if they have hypoxia. The metabolic alkalosis means that something related to the bicarbonate deficit. So the respiratory system is going to compensate that by hypoventilation, or you can give the individual kind of a bag that he will do respiration in that bag. And we have different types of metabolic alkalosis. And these are the types, just to know them. Okay, because what we are talking about is respiratory, don't forget. We will cover that in another occasion. Okay, the cause of the alkalosis in general, loss of the hydrogen ions, either through the renal system or the digestive system, اللي هو stomach. And this will cause a generation of bicarbonate in the blood. So if you lose the hydrogen ions, the body will start to reabsorb the bicarbonate. And that's why he will develop metabolic alkalosis due to loss of hydrogen, gain of bicarbonate. The solution of the body will be through hypoventilation. The body will start to do that. And you can treat the individual by doing hypoventilation in the bag. Now, the respiratory acidosis is related to the high concentration of carbon dioxide, which will reduce the pH value. And this is called acute respiratory acidosis. And there will be either normal or increase in the bicarbonate concentration due to the release of the acids. And in the chronic case, for a long period of time, you will have low pH, high carbon dioxide, but you have high concentration of bicarbonate after a certain period of compensation of the body to the respiratory acidosis. This is one of the nice tables that I want you to keep in your mind when we compare acidosis and alkalosis, and when we talk about respiratory acidosis and respiratory alkalosis, or metabolic acidosis and metabolic alkalosis. So it's a summary of everything that we described before. These are the normal parameters or normal values of the parameters that you have considered when you go to the hospital, and if you doing or reading what's called ABG, whole arterial blood gases values, okay? And you have to pay attention to the chloride, don't forget, because it's a major player when we talk about acidosis condition that are related to anion gap or high anion gap acidosis condition. These are the interpretation of the results that you could see in certain conditions, like comparing normal, for example, compensated mechanism with acidosis and alkalosis condition, just to have an idea what is going to happen in the body at the level of the bicarbonate or carbon dioxide or the pH value, if it's normal or overcompensated or uncompensated mechanism or partially compensated mechanism. هيك بنكون تقريبا خلصنا احنا محاضراتنا في الاسيد بيس بالانس. وهدول السلايدز الباقيين انا دائما بفضل اخليهم لانه they are presenting what we described before بطريقه مختلفه شوي، لانه في ناس يعني ممكن يستوعب بطريقه او باخرى. This is the glomeruli, for example, and this is how the bicarbonate is going to be filtrated in the tubular cells. And these are the renal tubular cells when they try to reabsorb the bicarbonate or generate the bicarbonate. So we have mechanism of reabsorption of bicarbonate in this way. وهذا حكينا عنه بأول المحاضرة الأولى. And this is how we generate the bicarbonate. So this is called generation of bicarbonate. الأولى كانت عبارة عن reabsorption of the filtrated bicarbonate. فقط لإعادة فهم ما تكلمنا عنه سابقا. هلا بنفس الوقت إنه إذا بنعمل release للأسيدز, which is the case all of the time, we have to release certain acids, certain strong acids in order to work as buffers in the urinary system, like phosphate buffer and ammonia. They are working as good buffers in the urine in order to prevent our body from burning the renal system. And this is how also we generate ammonia from the glutamine by glutaminase enzyme. And this is how it's going to be released by passive diffusion in order to buffer the hydrogen ion that we released in the urinary system. هلا بدي اعمل شويه مقارنات مشان نفهم الاشياء كيف بتصير بالجسم بمتغيرات الخلايا. على سبيل المثال في الgastric cells, if these are the parietal cells, for example, parietal cells are responsible for the secretion of hydrogen ions and the chloride, and there will be formation of acidic condition in the gastric lumen. Compared to the other side of the body, اللي هو plasma, if you release high concentration of hydrogens, you will retain bicarbonate in the plasma. So if you have vomiting, for example, you are going to lose hydrogen ions, and you are going to retain the bicarbonate due to the normal mechanism that you have in parietal cells, and this will be associated with metabolic alkalosis. As you can see, you have high bicarbonate and low hydrogen ions. This is what's going to happen, or that's why we have metabolic alkalosis when we have vomiting as a condition. While in the pancreas, the story is completely different. Okay, if you want to secrete certain fluids in the lumen of the pancreas, it will be the bicarbonates, because it's going to neutralize the pH, and you will reabsorb the hydrogen ions. This has not to do or has nothing to do with the acidosis or alkalosis condition, just to know how the cells are working in different ways depending on the transporters that you have in your cells. Compared to the colon cells, we have the same mechanism that is similar to the pancreatic one. هلا renal system, we have another story which is similar to the gastric one. هذول الكرتون diagrams بلخصوا كل الاشياء اللي حكينا عنها خاصه بالميتابوليك اسيدوسيس او الالكالوسيس او كانت الميتابوليك ولا respiratory one, اللي هو you start here to read the results and you can see the low pH value, which means that you have acidosis condition. فبالبدايه انت عندك acidosis، وهذا الاسيدوسيس مرتبط ب lower concentration of bicarbonate, so you can assume that you have kind of metabolic acidosis لأنه أصلاً الcarbonic acid أو الcarbon dioxide is low. So you have to start here. We have like kind of vomiting or losing, you have losing the bicarbonate in the due to any reason, could be renal system, and you have high concentration of hydrogen ions. So what the body is going to do is the following. Number one is here. This is the primary disorder, production of high acids due to lactic acidosis or another cause of the acidosis. So the compensation will be number 3, the respiratory system. And you have number 2, which is the renal system compensation mechanism. Sorry, here we have number 2 the buffering in the blood, and then 3 respiratory system اللي هو lines تبعون defense, and number 4 is the renal system compensation by releasing of the hydrogen ions and retaining of the bicarbonate in the blood. هذا الشيء كله حكينا عنه سابقا، ولكن هون على شكل كرتون بيوضح الستبس in a stepwise manner. هلا بالmetabolic alkalosis, the condition starts here with vomiting. You are losing the hydrogen ions and you retain the bicarbonate. So the respiratory system will start by doing hypoventilation, and the renal system will start to release the bicarbonate that you have in your blood in order to correct the metabolic alkalosis. In the respiratory acidosis, the cause is the something related to the renal, lung system. or respiratory system, and the compensation will start here by having high hydrogen or high bicarbonate and releasing the hydrogen ions from the body with the help of the renal system in order to compensate the respiratory acidosis. And in the respiratory alkalosis, we have vice versa. The system will start to reduce the ventilation of the system, as well as keeping the hydrogen ions in the body, and they help these guys to reduce the respiration or respiratory physiology process. And here, I think we are good. I hope the topics are understood. ركز أكثر شيء على respiratory, much more than the renal one, because we are going to discuss the renal issues when we talk about the UGS module. Any questions? طيب تفضلي.
عادي السلايد 22.
نعم.
عادي نرجع للسلايد 22 من المحاضرة الماضية.
عادي جدا، هي نفس السلايدات. نرجع للسلايد 22. Okay, let me share the slide first of all. This one. تمام يا رجال.
ايوه دكتور لو سمحت عادي تشرحهم على السريع اذا في وقت.
تمام. هلا الحالة الأولى نكون عندنا الكونديشن نورمال. Okay, you have this normal ratio of bicarbonate to carbonic acid, which has to be 20. And the pH value is 7.40. Okay. If you have acidosis as a starting mechanism, وكل هذا المثال بضربه على الأسيدوسيس. Okay, إنه في عندك acidic load. The first line of defense is to compensate or to buffer the system or to buffer the acids that you have in the blood by bicarbonate that you have in your bloodstream. Okay. By doing buffering mechanism as you have in the lab, for example, زي ما عندك بالمختبر البيكربونات. Now the second line will be the respiratory system by doing hyperventilation. Since you have acidosis, the hyperventilation will cause release of carbon dioxide from your body, and this will cause a reduction in the carbonic acid اللي هو سبب وجود الأسيدوسيس. If you have partial compensation, يعني at the beginning of the correction of the pH value, you will see a reduction in the bicarbonate as well as a reduction in the pH. It means that you did not correct the pH value. Still it's low, you have acidic condition, and you have low concentration of bicarbonate, but due to the reduction in the carbonic acid, you will have the same ratio, which is almost 20. انت بالحالتين في عندك low concentration of bicarbonate, but you reduce the carbonic acid by hyperventilation, فكأنك وصلت لمرحلة من partial compensation. هلا the complete compensation actually you are trying to compensate by the renal system, so you will excrete more hydrogen ions, okay, rather than doing hyperventilation انك تخلص من carbon dioxide. The renal system will start to release the hydrogen ions. At the same time, you will reabsorb more amount of bicarbonate in order to correct the ratio to be normal. Okay, so after the third line, يعني المفروض يكون في عندي هنا كمان خانة رابعة اللي هو full compensation. You will have normal concentration of bicarbonate and normal concentration of carbonic acid. But you are here at this level, you are still doing compensation by reduction of the bicarbonate and carbonic acid. هلا البيكربونات الريدكشن تبعه لأنه أنت في عندك acidosis. الcarbonic acid, because you are doing hyperventilation and renal excretion of hydrogen ions. Okay, after a while you will increase the bicarbonate لأنه بتعمل retention أنت or reabsorption للبيكربونات, and you will reach the normal concentration. as well as the normal concentration of the carbonic acid at the end of the day. So when you have full compensation after these, you will go back to the normal level of these in order to have the same ratio. هلا انت هون بتوصل للريشيو اللي هو 20:1 ولكن الاثنين عندك منخفضين لانه you have compensation. هلا هذا متى ببين معي؟ متى بشوفه انا؟ لما بقرا البارامترز اللي عندي في المختبر بشوف انه البايكربونات نازل، الكربونيك اسيد نازل، معناها the body is still doing correction or compensation. It's partial compensation process. تمام؟
أيوة شكرا دكتور.
يعطيكم الف عافيه. اذا في شيء ابعثوا لي اياه على الايميل برضه، احنا في عندنا لسه محاضرات ان شاء الله يوم الثلاث.